Okay, Courtney.
Should unmute myself before I try to talk. Hi, everyone, and welcome. My name is Courtney, and I am a former staff member with FFDA, and now I'm a member of the Families for Depression Awareness Volunteers, the Teen Speakers, which I have actually been a part of since 2013. I am so glad that you are all here tonight to join us for our program. From my experience, youth discussing living through a mental health crisis. This program is being streamed on Facebook for about the first 30 minutes. And after we end the live stream, participants in our Zoom room will join in the breakout room for discussions. If you'd like to join our breakout rooms, we do still have space. Go to our website, familyaware.org/trainings to register. We have a wealth of information to share with you, so please feel free to take as many notes as possible. We're going to be going through a lot of information, and while tonight is intended to be educational, enlightening, and inspiring, the discussion may be triggering or difficult for some people to hear. So we ask that you please check in with yourselves and make sure you're in a healthy space with your own mental well-being before participating. If you have any concerns about your own wellness, please consult with a mental health professional or healthcare provider. So this is what we're going to do tonight. I'll briefly familiarize you with Families for Depression Awareness, and then you'll meet our wonderful panelists seen here on the screen with me. We'll have a discussion about experiences with caregiving while dealing with their own mental health issues, and then we'll end the public part of our program and separate into breakout rooms. We'll have about 20 minutes during the breakout rooms to share ideas, questions, and strategies, and then come back to the main session and wrap up. Before you leave, please take our survey so that we know what we are doing well and what kinds of programs will be useful for you all. So Families for Depression Awareness was founded in 2001 to dispel stigma around mood disorders and provide information for family caregivers so they can provide support to their loved ones. Our mission is to help families recognize and cope with depression and bipolar disorder to get people well and prevent suicides. Some of you may know already, but mood disorders affect everyone in the family, not only the ones living with their own depression or bipolar disorder. In addition to the genetic component that increases the likelihood that children will also have a mood disorder, depression and bipolar disorder often affect relationships and day-to-day life. Parents may find it hard to engage with their children, take care of household chores, earn a living, and sometimes even get out of bed. Spouses, partners, and other family members might be wearing themselves out taking care of their others, making up for others' reduced capacity, such as taking on more of the work around the house, in addition to providing support and getting mental health care. We believe that each family member should be able to have their needs identified and addressed. We have a whole bunch of resources we'll mention tonight, and a lot of them are located on our website. We're excited that our completely reorganized website will be launching soon. So check it out at familyaware.org. On our website, we have free depression and bipolar disorder screenings, a mental health family tree to help identify patterns of potential bipolar disorder, and a caregiver stress test that measures your level of stress and identifies resources to help you manage it. While we may have a mixed audience of teens and parents tonight, this is for anyone 18 or older, and it's not a diagnosing tool. So make sure you follow up with a mental health provider after that as well. We do have a variety of publications to help provide educational content and some personal stories to help you better understand what it's like to support a loved one who lives with bipolar disorder or depression. There are a few listed here, including our 60-page handbook on helping someone living with depression or bipolar disorder. And it's jam-packed with information that would help readers be effective caregivers. And anyone who fills out our evaluation tonight will receive a free copy of our Preventing Suicides, Stories of Loss and Hope brochure, which is pretty incredible, I might add. Now, I want to introduce you to the two amazing people that are joining me here tonight. We're going to start by introducing Arenza. Arenza is a rising senior at the University of Massachusetts Amherst. majoring in English. After college, she plans to attend law school. Arenza's hobbies include singing, biking, roller skating, and reading. Arenza loves to volunteer, as well as being a member of Families for Depression Awareness's teen speakers. She volunteers in food pantries and clothing drives for those who need help in her community. So thank you, Aranza, for being here. We also have Michaela. Michaela is a 20-year-old student who has been speaking with FFDA for 4 years now. At events, she shares her experiences battling both depression and anxiety and time spent in hospitalization programs. She is now a college student studying to become a high school teacher, which also incredible. Thank you again, Michaela, for being here today. Now we're going to go into our questions. So I'm going to start by asking the first one. Michaela, I'd like you to answer first. So what does mental health crisis mean to you? Please share an experience of managing a mental health crisis in your life.
Yeah, absolutely. Hello, everyone. I hope you're excited to be here, and I hope that you take something away from this discussion. So for mental health crises, I think you'll hear that this can look differently to everyone. You know, we all would have a different perspective or experience on what that would look like. To me personally, I would define a mental health crisis as a period of being completely overwhelmed by your emotions, and you no longer feel like you can control them. And that can either be on its own, or it can come along with something we like to call, suicidal feelings or suicidal ideation. And you may experience wanting to harm yourself. In my case, that's usually what it looked like for me. So as a personal experience, that is pretty much how mine would go, is I would feel very overwhelmed by how I was feeling. I didn't feel like my actions were in my own control. My body was being driven by the emotions that were going through myself. All of my thoughts felt negative. They felt just overpowering. And sometimes that would lead to suicidal ideation or feelings of wanting to harm yourself. You're just so overwhelmed and so out of control. And so that's what a mental health crisis would usually look like for me.
Thank you. That's a lot of information. And it sounds like what it comes down to is feeling overwhelmed, out of control, and having high emotions, which can be pretty intense for anyone. Aranza, what was your experience like?
Good morning, everyone. Thank you so much for joining the panel, and I hope you've had a great day thus far. So for me, a mental health crisis would mean being in a situation where you're feeling overwhelmed, where you're feeling sad, dejected, where your thoughts are feeling mostly pessimistic rather than optimistic.
Do you have an experience of a mental health crisis in your life?
Yes. So when I was around 14, 15 years old, I was having these feelings that I was just describing, feeling overwhelmed, having mostly pessimistic thoughts about myself, about life. This was when I was in high school, where you're feeling like you have to fit in. You feeling like you have to talk to everyone, to be that popular kid. And with other things going on in my life, these things stressed me. And so I mostly kept quiet about it. I didn't really tell my parents about the situation. I would just write in my diary. And I think bottling up these feelings really impacted me. But eventually I was able to talk about it.
Wow. So again, we hear that theme of being overwhelmed, and you brought up negative thoughts, which I think we can all relate to due to this thing called a negativity bias. We tend to focus on our most negative thoughts, despite the positive and neutral thoughts. And also the pressures of high school. That's something everyone has to deal with. And then adding a mental health condition on top of that. Wow. I have lived experience with bipolar disorder, and I'm actually wondering, we'll start with Lorenza this time. What was the process of you getting help like?
So for me, I visited my doctor, who then recommended going to a mental health crisis center. Unfortunately, because of health insurance, which is in and of itself a problem when it comes to mental health, because if you don't have a specific insurance type, then you won't be granted access to types of help for those who are going through mental health problems like me. So although the crisis center that I went to tried their best, I was not able to get service there. So then my mother asked a former pastor to help me with therapy. He is a licensed psychologist, and I would have therapy sessions with him, I would say about once a week for several months. And that helped me in the long run.
That's awesome. So it sounds like because of different healthcare disparities in our community and in the country, you weren't able to get a traditional line of help, but your mom knew some amazing community resources and your pastor was able to help you in a unique way where he is a licensed professional. Michaela, was your experience different, or what was your experience like?
Yeah, I would say my experience was pretty different, which is one of the reasons I'm so glad that we're having, multiple perspectives on this topic, because there is no one size fits all for mental health. And that's the reason that we're here today. If there were, we wouldn't need resources like this. But from my personal experience, I was having a lot of those mental health crises that we just kind of divulged into what those might look like. And so when accompanied by feelings of suicidal ideation, you're definitely going to want to reach out to emergency services, which is what I did. And so that would usually involve myself being taken to the hospital. And then it was kind of just a period of where they couldn't figure out what they wanted to do with me. That sounds kind of messed up, but I would kind of just go home and recharge, and then we would fall back in the same situation. And this pattern continued a little bit to where it was really frustrating. And eventually we decided that a partial hospitalization program would be the most effective, since these feelings were very strong and very frequent. So a partial hospitalization program looks like someone attending, going to a mental health facility during the day, but you are released at night. It's not a live-in program. It's a step below that as far as severity. And so I would get services there. I would learn coping skills, meet with a counselor. That wasn't always successful. So I did spend a little bit of time in residential facilities, which are the same thing, except I was living on the floor. And after a few times of that, because those are not always intended to be long-term care, they're hopefully short-term care. At the end of the day, we want you on this earth functioning and strong enough to be on your own. So I would come out of there, and a big part that was so instrumental in my success was my school. We had this amazing program there, and my school was specifically building it for students who had prolonged periods of absences for mental health. And I was a freshman in high school at this point. So this is a turning point in my life, and having a program at my school that, believed in me and validated my experience changed everything about my high school career and my personal life. So I would say that was extremely instrumental. And also finding a therapist that worked for me, because I hadn't always had the best success in the past.
Yeah, I definitely agree that finding the right fit for a therapist can be a little challenging, and it is not one size fits all. I like how you mentioned reaching out for more support, and sometimes that's not always easy to do on our own. I remember in my experience, a friend found out I was self-harming and actually told a teacher for me. I was pretty upset with her at the time. And then looking back, I realized I wouldn't be where I am today without her having done that. It started the snowball effect of therapy, medication, different types of levels of care. Like you mentioned, Michaela, a partial program. I went to a community-based acute treatment or a CBAT, inpatient levels. And really, none of that would have mattered if I didn't have people in my life who I trusted. I know, Michaela, you mentioned your school was a big help. What do you want trusted adults to know who are supporting teens going through a crisis?
Yeah, absolutely. I think that, I'm glad that Courtney circled back and, really relayed that point of supported adults, because I didn't really get into that. And that is so crucial. You know, you need to feel supported and not feel alone, because it can feel extremely isolating to be going through some sort of mental health, you know, situation. It can feel like you're the only one on the planet who's experiencing this, like no one else is feeling the way that you're feeling, like there's something wrong with you. And, you know, having people in your life that can recognize those signs and be there for you can be the difference, you know, between night and day. So what I would want trusted adults to know, or to take away from this session would be that sometimes people aren't always looking for a solution to the problem, because problems, as they may seem black and white to an outside listener, to somebody who's going through them, it can feel much more complicated than that. And sometimes having a listening ear can mean a lot more than somebody who's trying to write you, you know, your ticket out of the whatever you're feeling, because sometimes it's not that easy. So I would say being an emotional ear rather than a problem solver would be a great skill. And I also remember when I was going through the height of my issues, I felt very much like people thought I was a ticking time bomb. And every time I was asked, how are you? It felt like there was a secret, like, are you going to hurt yourself, or something like that underlying. And it felt a little dehumanizing, like I couldn't be trusted to just be myself. And while that is important information that a trusted adult would want to know is your safety level, there's a way to go about it. And a great system that my family and I developed was some sort of a number scale. So I would use like how my day was on 1 through 10. That way, I don't really have to get into the nitty gritty of my emotions, but my family can still know where I'm at and know when I need a little extra care, because that is essential. You know, your safety needs to be communicated. But sometimes we don't have to get into the nitty gritty of what exactly is bothering you. We just need to know where you're at. So those would be my 2 tools.
I love that number system. I use something similar where I did use a number system or a color system, depending on the day, where it was, okay, I'm in a good space. We can talk about this. Or I'm doing well today. Like I'm really nothing to communicate, or, hey, I'm really struggling right now. So kind of recognizing those signs in other people, like you mentioned, having someone recognize the signs in you and just listening. That's a big thing. Arenza, do you have any advice that you would like or anything you would want a trusted adult to know who are supporting teens going through a crisis?
Yes, of course. So my answer to that would be for parents to first listen and not invalidate their teens, because when teens are going through this mental health crisis, or even anyone in general, you know, you're really vulnerable. And of course, you know, the first thing that people will, you know, assume is that, you know, hey, let's say like your teen didn't tell you that they were in a mental health crisis. You're probably gonna say, well, why didn't you tell me before? You know, or sometimes you just don't want to listen. And so it's best to try your best to not judge the situation. So like I previously said, the pastor would meet with me for therapy sessions over several months. And so one of the things that he recommended was for me to exercise. And he spoke to my mom about this, and she thought it was a great idea. So every morning before school, she would wake me up and have me exercise with her to exercise DVDs. And at first, I completely hated it. I didn't want to wake up in the morning. I didn't want to exercise. Like I would just try to sit down and cross my arms. But even with that, my mom was still determined to wake me up, regardless of how I felt, and exercise with me. And eventually, you know, over time, I started to like it. So, you know, and that's something I can also add to, don't give up, because it can be hard at first. But if you persist, I think that your team will really realize that you care for them and that you really want to help them. So now I really love exercising. That's one of the things that really keeps me mentally well. I do a lot of activities. Like you said in my introduction, I love roller skating. I also like biking. I sing, I play the piano. So I think that this can also help people. And what I said about not invalidating people's feelings, your teen's feelings, of course. I have an example. So I was at a funeral last week, and there were two relatives of the deceased. One was a niece, and one was a daughter of this deceased person. And they were speaking, they had testimonies to give about their relative. And those two women started going off on tangents, saying, talking about things in their childhood. You could clearly tell that these were things that, they went through unresolved feelings. And so, this is an example of what happens when you invalidate your children's feelings. You go into adulthood and you're talking about traumatic situations, and you're never getting past that because your parent was invalidating your feelings. And so as I was seeing these women talking about these aspects of their childhood, I felt a little sad, because I wondered, how would it be if my parents didn't listen to me, if they didn't care about my feelings, if they didn't listen? So this is really the message that I am trying to tell parents and teens.
Yeah, I think that is a really good point of validation, where it's not always easy. I'd like to point that out. It's a lot easier for parents sometimes to react to what their child is saying or be defensive. I remember talking to my mom, and a lot of it was, well, why? I'm like, well, I don't know why. And I think it's important to recognize that your child's trusted adult might not always be you. For me, it was a teacher. And I eventually began to be able to communicate with my parents through years and years of therapy and work on that. My mom and I actually went to a program together where we learned about validation and how to communicate in an effective way and stuff like that. So I think it's not that one size fits all, like Michaela mentioned. It is definitely a unique perspective to each person. And having the right resources is really important too. We've talked about a few resources as well. What crisis prevention resources have you used or would you like to share with teens and caring adults listening tonight? We'll start with Michaela for this one.
Yeah, I think having tools and resources at your disposal is instrumental with something like this. And I think we've already mentioned a great number of them tonight, but just to circle back to those, I think Arenza went more deeply into like coping skills and, resources on the lower level, because not all resources have to be defined as mental health resources. Things like sports, enjoyed activities, clubs, faith communities can restore, feelings of happiness and joy and give people things to look forward to, which when someone is experiencing depression is huge. You need something like that. For me, I love doing theater in high school. I like doing makeup, and sometimes I even like just being at work with my coworkers, just something that feels social and can get me out of the house. Those can change my whole day. On a higher scale, I mentioned my high school program. This is something that's in a lot of schools in Massachusetts. But things like that, looking into what your schools have, and even now as a college student, the first thing I did before I even got into my classes was evaluate what resources would be at my college, because even though I am an adult, I still need resources. I'm not a teen anymore, but I still need things in place to make sure that I'm comfortable, and especially in something as stressful as college. So I think just looking into what's around you is super important. And obviously in a crisis situation where someone is in harm's way, emergency services, hotlines, things like that, always need to have at your disposal.
Awesome. I definitely agree that there are levels of different resources, crisis or otherwise. Arenza, are there any others you'd like to point out specifically?
Yeah, so I personally have never contacted any hotlines related to mental health, nor have I been in psychiatric care. However, based on personal experience, I would say that, like Michaela said, find resources at your school, whether you're in middle school, high school, or college. Most of those places usually have resources for mental health counselors. For example, at my college, they have 24/7 service, and they serve all types of communities, including people who are minorities, women, those who are in even sports. And also, I would recommend the church. For me, like I said before, I did meet with my pastor, and we had therapy sessions. And so that's a great source. But of course, make sure that if you're in church, that your pastor is licensed in counseling or anything mental health related. And also churches usually do have mental health groups as well.
So it sounds like there's a whole bunch of resources that are out there for you. Parents, you as well. We'd like to share this slide because there are several different resources listed here. Please feel free to take a screenshot of this if you'd like to have it. Share it with your teens, friends, teens. Really, anyone can benefit from this. There are several phone, text, and online ways to get help. Beginning July 16th of this year, calls and texts to 988 will be routed to the National Suicide Prevention Hotline, which directs calls to the closest available crisis support providers. And they also have an online chat option. The crisis text line is one of my favorites, as is the Trevor Project, especially for teens and young adults. The crisis text line, you just text hello, any word to that number there, and you're connected to someone. And then the Trevor Project is great, having help specifically for LGBTQ youth, by phone, text, or online. The Trans Lifeline actually accepts calls from both individuals in crisis and their caregivers. And then we have right in the middle the Not Okay app, which is a free digital panic button to get teens immediate support via text, phone call, or GPS location when they're struggling. It really takes all of the guesswork out of asking for help, which is amazing because I think, as Michaela and Arenza can both agree, sometimes it's not always easy to ask for help, especially with your parents or your trusted adults. It can be a little overwhelming. And make sure your teen knows they have multiple options for getting help in addition to talking directly to you. Again, it can be a little overwhelming talking to our parents sometimes. So again, you might not always be your child's trusted adult, and that's okay. As long as they have a trusted adult, that is what matters. And I just wanted to say thank you all for being here and spending time with the three of us tonight. Please stay on if you plan to join our breakout room discussions. I did want to say a special thanks to our program supporters, George Harrington Trust, Jane B. Cook, 1992 Charitable Trust, Rebecca Pomeroy Foundation, Adelaide Breed Bard Foundation, Bennett Family Foundation, Thomas Anthony Pappas Charitable Foundation, John Donnelly Trust, and the Massachusetts Department of Public Health Suicide Prevention Program. If you are here for the live stream or watching the recording, please fill out the online evaluation. We really value your feedback and it will help us to develop more programs like this or plan for future programming as well. And again, if you fill out our evaluation, you will receive a copy of the Preventing Suicide brochure. And if this was if this session was helpful to you, please forward the link to your friends, family, and colleagues. They will be able to watch the recording at their convenience on Facebook and YouTube. And again, thank you so much for joining us tonight.